In the United States, we spend more money in raw numbers on a per capita basis or as a share of GDP than any other country. We have higher prices for medical care than any other country. We have advanced country. We have fewer doctors. And there's no end in sight to it. The Congress has not gotten religion on this. State governments have not gotten religion on this. I'm not going to say there's never not been any progress at all. There has.
Hello. Welcome again to the episode of the Let People Prosper series. My name is Dr. Vance Ginn. I hope you're having a prosperous day. Well, today is January 8th, 2024. I'm delighted to bring on another free market warrior, someone who is on the front lines about free market healthcare, something we really need, and the rising cost of healthcare, what it's doing to our country. And it's none other than Michael Cannon. Michael, welcome to Let People Prosper show.
Great to be here, Vance.
Well, it's really a pleasure to have you on. We've got a lot to talk about today. So before we get into all that, let me read your bio real quick, and then we'll jump right into it. So Michael Cannon is the Cato Institute's Director of Health Policy Studies. Washingtonian Magazine named Cannon one of the Washington, D.C.'s most influential people in 21, 22, and 23. He has appeared on many top national media, is the author of Recovery, a guide to reforming the U.S. healthcare. I'm putting that up right now, and we're going to talk a lot about that. He co-edited other books and has his own books as well. He previously served the domestic policy analyst for the U.S. Senate Republican Policy Committee, where he advised the Senate leadership on health, education, labor, welfare, and the Second Amendment all across the board. He holds an MA in economics and a JM in law and economics from George Mason University and a BA in American government from the University of Virginia. So with all that, Michael, the first question I asked all my guests is, why do you do what you do every day?
Okay, wow. The short answer is because I get to make a contribution to human freedom and make the world a better place. There's a lot more to it than that. My parents raised me Catholic. They raised me on Catholic social teaching and a Christian biblical view of humanity and our duty to our fellow humans. Whatsoever you do to the least of my people, that you do unto me. They inculcated in me a sense of obligation toward those in need. And, when I was younger, I was a social democrat when I was younger. I hung door knockers around my neighborhood for Michael Dukakis in 1988. That shows you how old I am. And that's because at the time I thought, well, you got rich people over here, you got poor people over there. There's a very simple solution to this poor people problem, which is we just send the extra from the rich, give it to them, and you're done. Problem solved. It took a lot of years and a lot of reading about economics and what the factors that caused that wealth in the first place before I understood that if you redistribute wealth like that, you destroy it. You destroy at least some of it, which makes it harder, actually, to improve the lot of the poor because you are really creating more poor people that way. You're making the problem that you're trying to solve worse. And with more reading and more study, I came to the conclusion that if you want to improve the lot of the poor, of those who are sick and vulnerable, you need individual liberty, you need markets. And that doesn't mean that you're going to meet all human need. There's still going to be unmet need there. But that sort of a system is going to result in less unmet need, fewer people falling through the cracks of the health sector and other sectors of the economy than any other system that, say, government might design.
Yeah, that makes sense. And are there certain assumptions that you come in with, looking at different schools of economics, talk a lot about economics on this, it's economist, and we talk about these things, but are there certain things that brought you to this view of free markets in the healthcare?
Yeah, there are. So you could put them into two categories. The first one is that individual liberty is right. It's just morally right. And the other one is that it works better at meeting human needs.
Yeah.
When I was a senior in high school, so still a social democrat and very opinionated and probably annoying to my government teacher and the students in my AP government class. This nice elderly couple came by to register us to vote, those of us who are going to be 18 by election day. And they took a poll of the folks in the class, and they were asking questions about various issues that voters and politicians might face. And one of them was, who here thinks that the government should impose a minimum wage? There should be minimum wage laws, and who thinks there shouldn't? And I was the only one who raised his hand to say that there should not be a minimum wage law. And that sort of made everyone in the room whip their head around and look at me like, you, the social democrat? But it came from this from this impulse is understanding that if two people want to agree on a wage that's lower than the minimum wage, then the government shouldn't be putting either one of them in jail for that. They're free, autonomous adults. They should be able to make that choice for themselves. So the first reason, the first thing is really a moral intuition that I think it's not really just. I don't like saying moral intuition. It's a moral principle that springs from the idea that we all have equal value, we all have equal dignity, and that implies that we should be able to make these economic decisions for ourselves, and no one else has any right to make them for us, or else that violates the principle of equality. That gave rise to this opposition to the idea of government interfering. But then it was reading economists like Milton Friedman. Someone once sent me out of the blue, without invitation, a copy of Friedrich Hayek's The Constitution of Liberty, which I think is over here on the shelf somewhere. If I can
there you go.
Find the H's quickly. It's on that copy is still on one of these shelves. And his discussion of physical coercion, how government has a monopoly over the lawful initiation of physical coercion, is the thing that restricts liberty and prevents markets from doing the maximum amount of good. That really tied together that moral principle I had, that it's wrong to use force to imprison people who contract for a wage below the minimum wage, and my moral value that we have an obligation to provide for the least in our society. That's what really tied the two of those together.
Yep. That makes a lot of sense. And, I come at it from a classical liberal angle. Some of those economists you mentioned with Hayek and Friedman and others that are out there really helped craft my viewpoint on a lot of things and other readings. When we're looking at this book, and it's a short book, Michael, which is great. You can read it quickly. Recovery here talks a lot about the healthcare sector. And I've got 3 kids. I know you have kids. And it seems like there's a higher cost of healthcare every year. And we talk to people, this is usually one of their biggest expenses oftentimes is how much their health insurance is and everything else. And they go to the doctor and the cost keeps going up, or oftentimes they may not know what the price is when they actually get the services that are rendered. It just seems like there's so many problems with our healthcare sector, yet the government's doing a lot. Shouldn't we have a lower cost and a better quality of healthcare? And so I wondered, from your research and the things you've been doing on healthcare for a number of years now, where would you start? How would you start this when you start explaining the healthcare sector to folks and why it has so many problems today?
If you are asking about reforms, I would start with 2 general reforms that have a lot of different subparts. But I'll explain to you what those are. They are that, number one, the wrong people in the U.S. health sector control the money. Government controls about 83% of health spending in the United States, even if it controls 50% directly, but another third indirectly. We call it private spending, but it's really spending that you have to do or else the government penalizes you for the pretty hefty implicit penalty of 33% on average. And that 83% is relatively high among advanced nations. I mean, the most control any government has over health financing, healthcare spending in any country is in the Czech Republic. That's 86%. So we're just within a couple of percentage points of that. And our 83% is higher than in countries with explicitly socialized systems like Canada and the United Kingdom. And the problem with that is that any economic system, it doesn't matter if we're talking about capitalism, socialism, welfare statism, dirigism, mercantilism, whatever, every economic system is going to serve the people who control the money. And the fact that government controls 83% of our health spending means that our system is not going to serve consumers. So the first thing we need to do is we need to change who does the spending. We need to change who controls the money in our health sector so that consumers control that money. And you need different reforms for people who are over age 65 and people who are under age 65. That's the main goal, so that everybody is controlling their own healthcare dollars. And once you do that, I talk about this in the book, prices are going to fall. Prices are going to fall in healthcare, and that's going to make healthcare more universal, because that's what delivers, or at least drives us in the direction of universality, is falling prices. We're not keeping 8 billion people alive on this planet for the first time in human history because government is subsidizing food or regulating food. No, we're keeping 8 billion people alive because falling prices for food have made food more universal. And we need to do the same thing for healthcare. The other category of changes is you need to get the government out of the way of people innovating with with new ideas that reduce the price of healthcare and that improve the quality of healthcare. Right now, there are tons and tons of barriers that government puts in the way of those sorts of innovations, cost reducing and quality improving innovations. And once you change who controls the money, it'll be a lot easier to get people to vote in order to get rid of those cost increasing and quality reducing regulatory barriers.
Yeah, that makes a lot of sense. And when you got into healthcare, first I wanted to say, how did you get into healthcare? Because there's so many problems with it. Whenever you start looking at it, it's like, oh, man, where do I start? But what really got you going into healthcare?
It's a funny story, but a sad commentary on the state of the liberty movement or the free market movement. I got into healthcare because that's the job that was open. As I suggested before, I wanted to make a difference in public policy. I wanted to help improve people's lives by expanding individual liberty and allowing the market system to reduce unmet need, whether it's food or clothing or shelter or medical care. But I had no particular desire to work in healthcare. I would have been just as happy to work in education or in labor economics or any of a number of other areas. But I took a job in health policy because that's the job that was open. And they said to me, we want to offer you this job, but we got to warn you, there's a reason this job is open. It's because nobody else wants it. Nobody else at the free market organization where I was working wanted to work in healthcare. I said, I don't care, I'll take it. And it's a funny thing because I have asked lots of people who work in health policy on the free market side, why, how did you get into doing health policy? 9 times out of 10, or even more often, their story is just like mine. That's the job that was open, and that's a kind of a sad commentary on the state of the liberty movement or the free market movement, that we don't have people who are getting into health policy because getting into public policy because of healthcare. On the left, on the pro-government intervention side, you have just legions of people who are entering politics, entering public policy because they want to work on this issue. But we don't have that on the free market side. And that creates what I call a wonk gap, that a lot of my work is work that I undertake to try to narrow that gap.
Yeah, no, that's good. And it's interesting that you got into that way. Going back a little bit, we got some of the solutions that we want to kind of build into. How do we get to those solutions? And with your background and everything else, I think you're the perfect person to talk about this. Have we ever had a free market system in healthcare? I mean, because there was some talk about, they're in the 30s and employer-sponsored healthcare thereafter and things of that nature. But even before that, was it mostly a free market?
Well, we did, but not for 100 years or more.
Yeah. Okay.
You see, about 100 years ago, maybe a little more, at around the same time that medicine went from being net harmful to net beneficial, because that was only with, about 100 years or 110 years ago. 2 things happened that set us on this course to have the government basically dominating healthcare in the United States. One of them, the first one, was state governments started telling people that you have to get permission from us before you can practice medicine. Ostensible reason for these regulations, what we call clinician licensing, you had to get a license from the government to practice as a clinician, was to improve quality, to make sure that quack doctors and others weren't out there hurting people. I think that was, while that has surface plausibility, the way that it's actually worked is it has caused more people to fall through the cracks of the health sector. It has increased prices. It has reduced the quality of care and led to all sorts of problems that the government to intervene again and again just to fix the problems that the government itself solved. The other government intervention that occurred around that time, this was 1913, was at the federal level, and this was the creation of the federal income tax. The federal income tax was that the Congress created in 1913. It was actually the second federal income tax. There was one during the Civil War, and then they let it expire. And I always mention that because I'm hoping they let this one expire too, because this one has done vast amounts of damage to the U.S. economy broadly, but in particular to the health sector of the economy. And it did so because even though Congress didn't say anything about healthcare or employer-sponsored health insurance in the statute that created the income tax, because employer-sponsored health insurance didn't exist in its current form back then. Once the Treasury bureaucrats who are implementing the income tax had to wrestle with the question of, should we include healthcare or health insurance that employers are providing to their workers as taxable income, they made a horrible mistake, which was they decided not to include employer-sponsored health insurance or employer paid health care as taxable income, which might sound great to a libertarian or a free market advocate because good, the government isn't taxing something. But it created a situation where either you spend your earnings, let your employer spend your earnings on what the government favors, employer-sponsored health insurance, in which case no taxes, or you try to take that money as income and then spend it on something other than health insurance, or just health insurance that you prefer, that meets your needs. Health insurance that doesn't disappear when your job does. If you want to do that, you first have to pay taxes on that. And that's an average implicit tax penalty of about 33%. And so the government created this situation where effectively you have a mandate to purchase employer-sponsored health insurance, or you have to pay more money to the IRS. And that is a lousy way to set up a health insurance system. It has created as many or more problems as licensing has. The biggest problem it has created, well, I mean, it has increased the prices for health insurance. It has stuck people with lousy health insurance that disappears when your job does, so that it fueled the problem of pre-existing conditions, because you enroll in employer-sponsored insurance, you get sick, you change or lose your job, and all of a sudden you have an uninsured and uninsurable pre-existing condition. Whereas if the government had just left people alone, they could have bought lifelong insurance. Back when Congress created the Medicare program in 1965, there were people who had insurance that would cover all the way to the grave. But Congress had been penalizing that type of insurance for decades. And so when it looked around in 1965, it saw that a lot of seniors didn't have health insurance because of what Congress itself was doing. So it created the Medicare program in order to cover them. So Medicare was really an attempt to clean up a mess that Congress itself made when it created the income tax back in 1913.
Wow. And you make this all clear in the book, too, for the recovery for the audience. So you need to go back and read this. And it's interesting from a market perspective, right, is you've got the supply side that's being reduced, restrained from all the licensing and everything else that's going on. And then you've got the demand side that's increasing because of all the subsidies are in the employer-sponsored healthcare situation. So no wonder we have rising prices when you're restricting the supply and you're increasing demand compared to the private sector, the private cost and benefits. You're going to see increasing prices. And unfortunately, the quality hasn't kept up. I mean, we have seen quality improvements, but not to the rate that the prices have been going up. That should be a subjective value determination within each one of those market active actions that happen within the healthcare sector that we just don't see. One of the things I think that you bring it really well in the book, Michael, is the connection though with that employer-sponsored healthcare. And you just did it nicely there. But what are some of the other areas that you've seen how it's kind of infiltrated the entire healthcare market and made it such that, and I loved your point too about it, it's a government created problem for a government solution. It seems like they're doing that with everything these days. They don't want to look at the underlying cause being government, but that the government can solve those problems somehow. But whenever you have you have you have Medicare, you have Medicaid, then we had Obamacare. Now they're still trying to figure out all the other things that are going on. How do you piece some of those things together as well?
All of those things are interventions that the government launched into the health sector of the economy to try to fix problems that the government itself created with clinician licensing, with the income tax, and some other government interventions. Insurance companies, states have traditionally regulated health insurance, and starting in 1996, Congress really began regulating health insurance as well. And Obamacare is a full-throated attempt by the federal government to regulate health insurance and sort of crowd out the state's traditional role there. But when states started regulating health insurance, that too created more problems than it solved and led to further government interventions to try to solve those problems. Obamacare represents some of those. I mean, Obamacare itself is an attempt to fix the problem of pre-existing conditions that the government itself largely created or exacerbated. The problem of pre-existing conditions ended up being a much bigger one because licensing increased prices for medical care, because the tax code increased prices for medical care and health insurance and threw people out of their health insurance after they got sick. And so what we're really dealing with here is a real life example of that nursery rhyme, the old woman who swallowed the fly. You remember there was an old woman, she swallowed a fly. I don't know why she swallowed a fly. Perhaps she'll die. Well,
right.
What did she do in order to go after that fly? Well, she swallowed a spider to catch the fly. Okay, well, now she's got a spider that wriggles and jiggles and tickles inside of her. What does she do? Well, she swallows a bird to catch the spider. Well, now she's got what does she do about the bird? Well, she swallows a cat to catch the bird. And then she swallows a dog to catch the cat, and a goat to catch the dog. And both state governments and the federal government have been doing this over and over. They intervene in the health sector, the economy in one way that causes more problems than it solves. And rather than undo that intervention, rather than induce vomiting, if you will, they decide they're going to intervene more and more and more. And each one of these interventions just causes more problems than what came before it. And you end up with it in a situation where in the United States, we spend more money in raw numbers on a per capita basis or as a share of GDP than any other country. We have higher prices for medical care than any other country. We have advanced country. We have fewer doctors. And there's no end in sight to it. The Congress has not gotten religion on this. State governments have not gotten religion on this. I'm not going to say there's never not been any progress at all. There has. And we can talk about what some of that is. But the situation is so bad that it's even worse than what you were describing. Vance, about prices going up and quality not rising as rapidly as it should. Everything you said is true, but the problem is actually so much worse. Quality is not only not going up as rapidly as it should, it is so far short of what it could be. I have some examples of this in the book. I talk about the drug Vioxx, which Merck introduced, I don't know, it was a couple decades ago, and the FDA pulled off the shelves. This is a painkiller, non-steroidal anti-inflammatory drug from the COX-2 inhibitor class of pain relievers that by all accounts worked. People who took it reported good results, but people began to suspect that it might be causing adverse events like heart attacks. So adverse cardiac events. But the effects were small. They were at a small share of people who took this drug, so small that it didn't come up in the clinical trials. It wasn't detectable in the clinical trials that only enrolled a couple thousand people. That's how many the FDA usually requires you to enroll. But once it was out on the market, this is a blockbuster drug and millions of people were taking it. And people began to suspect that it was hurting people. The FDA, which is supposed to monitor drugs after they make it onto the market, was just terrible at monitoring. It's just terrible at monitoring drugs in what they call these phase 4 monitoring efforts. But you know who did provide the data that finally convinced the FDA that Vioxx was hurting people? It was a health plan that was the result of a market innovation called Kaiser Permanente that combines insurance, unlike every other health plan in the country. It combines both health insurance and healthcare delivery because all of the doctors and all of the nurses and the hospitals, they're all part of the same corporate umbrella as the insurance plan because they all work for the same company. They're integrated is the word we use in the business. And they also have different financial incentives than the rest of the health sector. What that all does is it combines to give them an incentive. Unfortunately, a unique incentive in our health sector to use electronic medical records. Kaiser has been using those since the 1960s. And because of that, they were able to collect all the data on all of their enrollees who had taken Vioxx. And they were able to identify, yep, it's causing heart attacks.
Wow.
They were able to, the market did the FDA's job better than the FDA did. And yet, there's a reason why we only have one health plan like that in the United States. And it's government regulation. Every government regulation we've mentioned so far has blocked that model. The only reason Kaiser Permanente broke through is because Henry J. Kaiser, who helped found it, was a bazillionaire who had enough money to build his own hospitals and get around all the regulatory obstacles the government put in his way by sheer force of economic power. And if it weren't for all of these interventions, I have a quote in the book from Milton Friedman from the 1950s, saying that if it had not been for all of these government interventions, we probably would have a lot of health plans like that, just littering the landscape.
Yeah. And
they would be collecting data on what works and what doesn't, and quality would be so much higher than it is right now.
Yeah.
We wouldn't even need the FDA. The FDA, I think, is another intervention by the government to fix problems that the government itself created. So the quality picture is everything you said is correct, Vance, but the quality picture is so much worse than what I think what even most health policy people recognize, that we've gone beyond swallowing the horse. We're like the old lady who swallowed the elephant and is eyeing that blue whale over there.
Maddening. It really is. I mean, it was something as important as our health, that we don't have the competition that we need. We haven't even talked as much about the certificate of need laws that you have in place, to where you have to show that there's a need versus being able to just open up a hospital, which we should be able to have. I know that part of this work would also be about nurse practitioners being able to do all of the work that they're capable of doing and taught, versus the licensing laws that are in place, where they have to have a doctor basically confirm or allow them to do what they're going to do. And too often that doesn't happen, which also brings up the price of these things. I mean, we need a lot of delicensing across many areas of the economy, but I think this is also a big sector where that's needed as well. One of the things, Michael, is we're kind of wrapping up some of this here, and there's so much to talk about, of course, is how much influence that healthcare is having on the budget. With my time at OMB and doing a lot of work on the fiscal policy side of things, it seems like, especially on the right these days, we're seeing people who don't want to touch Social Security and Medicare and these sort of things, while those are the ones that are growing the budget by leaps and bounds and are putting us in this fiscal crisis that we're currently in. So we've got a healthcare crisis that's also contributing to a fiscal crisis, yet nobody seems to want to solve it. And I wonder, from your perspective, Michael, as you've been working on this a lot longer than I have, how do we get control of this somehow to at least start to bend the cost curve, get us back on track to some sort of healthcare and fiscal sanity for America?
I've reached a conclusion that the only way we're going to restore any semblance of fiscal sanity or limited government to the U.S. government is with a balanced budget requirement in the Constitution. Mm-hmm. And the reason for that is, if you don't have a balanced budget, we've seen this for decades and decades. If you don't have that sort of a requirement, then the politicians are going to promise goodies to people. They're going to want to spend money and throw some at you, and a lot of money at defense, a lot of money at healthcare, and then cash to seniors through Social Security, money for education, money for transportation, money, just buying votes from special interest groups at the expense of taxpayers. But taxpayers don't like it when you tax them. So what the politicians do is they figure, well, we will buy as many votes with spending as we can, and raise taxes as little as we can and still get away with it. Because if let's be honest, if we paid for all of this spending by raising taxes on people, they'd throw us out. Because people don't actually want government as big as it is right now. What Congress has done for decades now is they have said, we're going to buy all of these votes with all of this spending, and we're going to pass off a significant share of the cost of all this spending onto future generations by financing it with borrowing, by financing it with deficits and debt. And as long as they can do that, that's the lowest cost option for them. They're going to continue to do that. And why wouldn't they? Those are the incentives that the system creates. So, and there has always been, and while this is happening, Republicans have been part of the problem as well, because they have campaigned for tax cuts that they do not couple with spending cuts. In fact, they often propose spending that they don't couple with tax increases. And if you do that, if you cut taxes without cutting spending, then you are not reducing the size of government. All you're doing is pushing part of the cost of government onto future generations who cannot vote yet, because they probably aren't even born yet. Mm-hmm. So that's really, deficit spending is really taxation without representation. Yeah. And as long as Democrats can spend and Republicans can spend that money, and Republicans can cut those taxes, and they can all gather votes by doing that, they're going to keep doing it. And it's not until you have something like a balanced budget requirement of the Constitution that requires them to pay for every dollar of government spending with a dollar of taxes on current voters, are you ever going to get those spending levels down? Because when you have to tax current voters in order to get those spending levels down, when you tie spending to taxes, that's the only way you're going to motivate taxpayers to reduce spending from the levels that it's at right now. So if what you want is to limit government, you should embrace a balanced budget amendment to the Constitution. There are different ways of doing it. The way I prefer, but I would take my second or third choice over what we have right now.
Yeah.
You should be pushing for that, because that is even if it means that there will be a tax increase in the short term, because number one, that tax increase is not going to increase the size of government. It's the spending level that determines the size of government.
Right.
And yes, that tax increase might hit you. And yes, it might hit your neighbors. And yes, it might make you really angry. But we need you to be angry. We need you to be much angrier than you are right now. And other people to be angrier than they are right now about the size of government, because that's the only way to motivate them to effect change and reduce unnecessary government spending.
Yeah.
And when you talk about government spending, the prime target there is going to have to be healthcare.
Yeah.
Because there are lots of expensive items in the federal budget: defense, Social Security, but only one of them is growing as a share of GDP. Only one of them is causing the federal government to grow as a share of GDP. That is healthcare. And yes, the federal debt is growing as a share of GDP. Interest payments on the federal debt are growing as a share of GDP, but that's because healthcare is growing as a share of GDP.
Yeah.
So if you want to, and the reason I've reached the conclusion I have about the necessity of a federal constitutional amendment that requires a balanced budget is the politics of cutting healthcare spending are so tough that it's not until you have those anti-tax voters on your side that you're going to be able to do it.
Yeah, it's a great point. And one of the things I like a lot, Michael, is spending limits. And that's another type of a limitation that you can put on there. Because I mean, you're right. That's the main focus. That is the driver of government. That is the best indicator of government, is how much it spends, not how much it taxes. But putting those two together are going to be important. And unfortunately, we're also paying for it today just through the form of higher inflation. Because then the Fed prints a lot of that money. They take that debt and print more money in the economy. We're seeing a lot of the inflation that's out there and everything else in the economy. And it's also unfortunate because many people are going without, a lot of the drugs that they could be using to do something today because the FDA hasn't approved it. There are the seen versus the unseen, right? We get a lot of these seen things that are out there, but there's so much unseen. To your point earlier about the quality, yes, the quality is bad, but it's not nearly as bad as what we really know, because of how much we've missed out on over time. And I think it's unfortunate. And something that I'm trying to do with this Let Fuel Prosper show and a lot of the work that I'm doing on free market stuff is, how do we get government out of the way, for one, to have more liberty and freedom and prosperity and all of that, but also number two, highlighting the cost of this. I mean, I think, free market capitalism has gotten such a bad rap for so long because people want to blame the healthcare sector. That's why I started with, when was the last time we actually had a free market healthcare? Because some people will blame the free markets for what's happening in the healthcare system, when you're doing such a great job of saying, well, no, there's no free market. It's a government dominated market. And that's in healthcare, that's in education, that's in transportation. I mean, a lot of the areas of our economy are not free markets. It's basically a socialist system. They call it a mixed economy, but I mean, we're based a lot on government influence through regulations, through spending, through taxes and everything else. And I'm hopeful that we can get back to some sense of free market capitalism. And I think you're exactly right. It's got to start with healthcare. And so as we're really wrapping up here, just a couple minutes left, what are the key things that we could do in order to bring this all together to make sure that we can have some form of free market healthcare system in the future?
So I offer proposals in the book about how to do those two things that I mentioned: change who controls the money, so consumers control the money, and get cost increasing, quality reducing regulations out of the way. On the first score there, what you do is you change the tax code so that the government is no longer penalizing people who don't. Penalizing people who want to control their own healthcare, health insurance dollars and decisions. Yeah. Right now, the tax code does that by saying enroll in employer-sponsored insurance, let your employer control $17,000 of your earnings, or you pay a hefty additional tax bill. Let people control that. That $17,000 amounts to $1 trillion across the economy. That's how much of workers' earnings employers are controlling and using to make the workers' health insurance decisions for them. Let the workers control that $1 trillion. They will then approach their health insurance and their healthcare consumption decisions in a much more cost and price conscious way, and that will drive down prices and make healthcare more universal. Same thing with the Medicare program. Instead of giving Medicare enrollees a government-defined package of benefits where the government defines what the prices are going to be and all of that, just give them the money like Social Security does. Social Security doesn't set any prices. It lets markets set prices. Have Medicare do the same thing. Give sick enrollees higher Medicare checks. Lower income enrollees, higher Medicare checks, healthier and wealthier ones get smaller Medicare checks, but just give them the money, and then they will approach all of their health care decisions in a much more cost-conscious way, and that will drive down prices as well, making healthcare more universal. And then once you've done that, and people see in their own in their own household budgets, the cost of all of these cost-increasing regulations that say states impose by telling you that no, you can see this lower price telehealth provider because they don't have a license in your state. They might have a license in the other 49 states. They might be the top oncologist in their field in Boston or Chicago or Los Angeles, but your state says you can't see them because they don't have a license in your state. These licensing laws are not about quality if they're blocking your access to the top quality providers in the field. Once consumers see the impact that these regulations are having on their household budgets, it'll be easier to get them to vote to repeal those regulations or just change them so that a clinician with a license from any other state can come into your state and practice medicine. So that dental therapists, which a lot of states just prohibit entirely. These are dental care providers who have more training than a hygienist, less than a dentist, so they can do cleanings plus fillings and extractions and so forth. And they make those services more affordable than if you get them through a dentist. Let people with licenses from other states practice in your state under the terms of that license and under your state's medical malpractice liability rules to protect patients. And that will drive down prices further. That'll also eliminate a lot of barriers to the quality improvements that we've been talking about, from innovative insurance designs and other ways of delivering medical care. There are lots of ideas about how to do this in the book. I do argue for eliminating clinician licensing entirely because it has had a net negative impact on prices and on quality. It is not helping us. It is not what provides protection to patients in the medical marketplace. We should just get rid of it. But having made that case, I also acknowledge that it's probably not going to happen in the short term. So I offer some reforms like states just let clinicians from other states practice in your state. And fortunately, a couple of states have taken steps in that direction. More should, and they should all take additional steps in that direction.
Wise words, Michael. As always, it's always a pleasure talking with you. Again, the book is Recovery, A Guide to Reforming the U.S. Health Sector. It's a short read, and it has a lot of great information in there that I hope everyone in the audience will go and check out. Thank you, Michael, for being on the Let People Prosper show. God bless you and your family.
Thank you, Vance. Take care.
All right. Well, for the audience, thank you again for listening today. Please go out and rate and review this podcast. Give us a 5-star rating, if you will. Share it with your friends and family and all that good stuff. And you can find all the show notes at vanceginn.substack.com. Until next time, let people prosper.